Whenever you're ready, Tim.
Hello and greetings from your Missouri House. I am Tim Jones, State Representative from the 89th District here in the state of Missouri, and we had another very busy week here at your state capitol. This week we passed a very important bill on the House floor yesterday in its perfection form. Today we will likely third read the bill, which means we'll be passing it out of the House and it will go over to the Senate. The bill is commonly referred to as the Prompt Pay Act, and is a bill that is very important for all Missouri citizens. In essence, what the Prompt Pay Act will do is close a loophole that occurs in the health insurance industry, whereby for the past 10 to 12 years or so, insurance companies have had the option to suspend the payment of health insurance claims. This has caused a lot of consternation in the healthcare field, as you can imagine, because many claims provided by doctors and healthcare providers have simply gone unpaid for many months, if not even years, by health insurance companies. Without necessarily casting blame on any one side or the other, we worked out a very effective compromise this year in both the Missouri House and the Missouri Senate. I want to thank my co-sponsors in the Senate, Senator Jim Lemke and also Senator Matt Bartle, who did yeoman's work in bringing together all the parties on this. This is mainly an important bill for all of the healthcare providers in the entire state, whether they're doctors in small rural communities, whether they're small rural clinics, or whether they're large hospitals in downtown St. Louis or downtown Kansas City. The system that this bill proposes to now put into place will provide a very streamlined process for when you go to the doctor and then your doctor turns that bill over to the insurance company. We will have a new streamlined process for how those bills are actually paid. They'll be paid in a much more timely and efficient manner. It provides certainty for the healthcare system, and I submit will reduce costs. This is true, meaningful, positive healthcare cost reform, and it is something we did here in the Missouri House by a bipartisan vote of 155 to nothing. What a difference that is from the political partisanship and the gamesmanship and the backroom deals being cut in Washington, D.C. We were able to come together and do something that was meaningful and good for all Missourians in the area of healthcare reform. This weekend we have our statewide Lincoln Days in St. Charles County. I will be up there with Republicans from around the state working on our vision for the future as we enter into the 2010 election cycle. On Saturday morning I'll be speaking to a group of the Republican National Lawyers Association. If you happen to be in St. Charles County this weekend, please stop by and say hello. Thank you again, and I will look forward to speaking to you next week.